Welcome to Thursday Thought Leaders with Harbinda Narula on BW Healthcare World. When we look at the healthcare industry, there are services in the business beyond hospital and diagnostics. One such service is that of ambulance. Now, this has been a fragmented service which has been largely unorganized, and companies like Medulens and Red Health have come and tried to disrupt this space. Today, I have my guest, Prabdeep Singh, the founder of Red Health, and I'd like to understand from him how he thought about Red Health in the first place, what motivated him to get into this industry, and how is he planning to expand and stay ahead of the curve. This is one of the only 7 ambulance companies across the world to have JCI accreditation. Let's speak to Prabdeep and get some more information about Red Health and the business of ambulances and what's next for them. So, Prabdeep, thank you so much for joining us on BW Healthcare World today. As always, it is a pleasure to have you with us. And Prabdeep, I remember having a conversation with you last time, but it was more inclined toward what you were doing and what was the way ahead. But we never touched upon how did you actually think about setting up Red Health? And what motivated you to get into this business in the first place? So let's begin the conversation trying to understand your mindset as to what motivation was there for you to establish Red Health.
At the outset, I want to thank you, Harbinder, once again for giving me an opportunity to speak to BW. It's always a pleasure of mine speaking to you, whether it's face-to-face or virtually as we are doing now. The origin of the business is deeply personal, and a lot of us in India live away from our loved ones. Some of us are fortunate to live within the boundaries of India, but a lot of Indian diaspora lives away abroad, and that's something that I was doing in 2014, living away from my parents in Brazil, and my family member, in this case, my dad, had an emergency that made me feel that this is a problem worth solving. Not only is it the helplessness that you feel when you're away, but also the knowledge of the inadequacies of the system in India, right? And it is not uncommon for Indians to call their family rather than a professional or a hospital in case of emergency, because our general trust in the system is so low that they will not pick up the call or who will show up. We end up taking our personal transport. So this is something similar that happened with my family. My dad's doing okay, but this pulled me away from what I was doing earlier, which was pharmaceuticals. Being in pharmaceuticals or healthcare industry at large had already given me the insights how large this market and problem statement is. But when it happens close to home, it led me to come in and solve this problem.
Awesome. And Prabdeep, when you got into the business of ambulances, as I understand, correct me if I go wrong, but the business of ambulances has always been a very disorganized business, something which was very, very fragmented. A lot of unscrupulous activities I've heard used to happen where the drivers would steer you to a hospital where they get their commission from. And so, how does organizing the ambulance space really help the healthcare industry? And what are the kind of challenges did you that you faced when you were establishing Red Health? And how did you overcome these?
Absolutely. What you have read about and heard about the industry is sadly true. Ambulance operators in India are non-trained, they're unskilled, and their core reason to exist is to divert patients from the hospital they want to go to a hospital that's ready to pay them a certain rupees or a percentage commission to bring a patient into their doors. And for this reason, the overall trust in the system has fallen. And because there is no enabling or disabling regulations around who an ambulance operator should or should not be, there is a proliferation of these unskilled operators. We have more regulations around licensed cab drivers, or even auto rickshaws in some cities, but the regulation around who an ambulance operator is doesn't exist, right? So by that virtue, we have a proliferation of these fragmented operators, mom and pop operators who have less than two ambulances. Look, credit to them, they enable a very important service, which is transporting a patient in case of emergency or non-emergency, which is their goal. In case of emergency or non-emergency, from the point of care which is required to a healthcare provider, which is a hospital in most setting. But over time, these operators have become nothing more than commissioning agent, while also servicing the more dead body transport rather than patient transport. So when we came into this market, our intention was not to be an ambulance operator, but to be an emergency response provider and keep clinical outcomes at the center of the universe. So what we've done now that we're a JCI accredited organization, only seventh globally in medical transport, the first in Asia, we always thought that we're going to solve for the entire paradigm of emergency response, from a person knowing that they need help to the person calling in to help and then getting the help that they need. The entire value chain is where we exist. Organizing is one aspect. We ended up completely disrupting the industry, right? The chassis we chose, the equipment we chose, the skilled man force that we have, all of this is a complete difference from what existed before. And as we raise the standards of the industry, every other industry participant also started upgrading, or else they were not finding favors by with the patient or the hospital client. So today, I am very proud that over 100 hospitals, 9 out of 10 hospitals, top hospitals in the country, if you call into their system, the call is answered by Red in emergencies, from having one ambulance parked inside their gates to now operating as a seamless network of ambulance across the country. So if you're a hospital in Delhi, but your patient is in Panipat, or your patient is in Rohtak, or your patient is in Solan, it doesn't matter, because Red is going to be able to pick that patient in the most clinically reliable way. That's what we've accomplished. So while we are organizing, I would like to say we are disrupting and then setting the standards for the industry to follow.
Pravdeep, this is very strong because when you're talking about setting the standards, healthcare has always been a need-based business. Nobody wants to go to a hospital until it is absolutely necessary to do so. And within healthcare and the way the hospitals work, emergency care is about prompt response, because there's we talk about golden hours, etc. What and then you also spoke about the chassis that you decided for your ambulance, and you're talking about standards. What role is Red Health playing when it comes to innovating the way the emergencies are managed? So, what is it that you are doing differently when it comes to your ambulance? And what is it that you do differently when it comes to managing the emergency from the time the patient leaves home until he arrives at the hospital?
Absolutely. The first discovery that we had very early on is that the patient doesn't want to remember one number, but the patient wants you to be still present everywhere, right? So, what this means is that we had to be present on all platforms and all places where an emergency can be called or an emergency can occur. So, in our lives, we occupy certain places. We are at our home, we are on the road, we are at our workplace, we are at an event, a concert, in a theater, mall, right? So think of the places we occupy. And the first discovery that we had is that most of these places don't really have a plan around emergencies. So today we are partnered with large malls, with communities, with schools, with universities. We are present in multiple large offices, factories. So that was our first idea, that rather than a patient in case of a need needing to remember a number, how can we be closer to them? Then we said people already have applications, people already are used to a certain workflows in their lives. How can we integrate there? So we are now on Acco's insurance app. We are on multiple different applications. So for example, we have just integrated with one of India's largest airline, and we are on their app as well. So our belief set is emergencies should be institutionalized from any place, from any platform, without you needing to remember a number. Now, if you were to remember a number, it doesn't need to be Red's number. Our number is very easy to save. I'm going to do a shameless plug. It is 911 911 911. 911 is the US emergency number. And 4, you can remember it as for any emergency. So 911 911 911. So we essentially started being omnipresent, and with a thesis that patient is going to first call their healthcare provider, and we can enable those healthcare providers to answer in the most efficient form. What was the problem that our large hospital was facing? Their entire telephony system and response system was based on the assumption that they will get appointment calls, right? 1 out of 100 call is an emergency call. So if they're getting 10,000 calls in a day, right, you are not going to set up a separate call center or a separate skilled workforce for emergencies, because only 100 calls will be an emergency call, right? But an emergency patient, from a monetary terms, is worth a lot, and that's intuitive. So hospitals had a problem that they were getting 1 out of 100 emergency calls, and they were missing 70% of these calls. So, and maybe you can guess, what is your confidence level if you call into a large public hospital today that they will actually pick up your emergency call, right? I'm assuming it is low. The same thing used to be with private hospitals till a few years ago. Surprisingly, all those hospitals that worked with us answer 99% of their emergency calls in under 2 seconds, right? So we solved that problem. And then the next problem that hospitals had is they only had 1 or 2 ambulances deployed. Now, if you are a large hospital in Shalimar Bagh or Gurgaon, or for that matter on BG Road in Bangalore, and you get a patient call which is from 10 kilometers away, by the time you send an ambulance, you are taking 8 to 10 minutes, because you're picking up a paramedic from the emergency room, you're having a driver come in, that driver does nurse bus driving, that it does staff drive. You can understand these logistics, right? So that ambulance would take 14 minutes on average to leave the hospital. Patient should be reached in 12 minutes. Hospitals were taking 14 minutes. And by the way, some of the largest hospitals that don't work with us, they still take 15 minutes, 14 to 15 minutes to have an ambulance leave their gates, right? And then comes the problem of actually getting stuck in traffic, which often we think of. So we started, when we drew the time chain, we realized traffic is not that big of a problem. We are not answering the calls. We have no technology to actually notify the ambulance to leave. The staffing is not dedicated. The ambulances are not ready. And then the fundamental question, why should an ambulance be parked inside the hospital when it should be where the mall is, where the community is, the part of the problem that I explained before, where we are there. So now if you're a hospital getting a call, we are answering it with our software and telephony. You're picking up a call in under 2 seconds. And because Red is there near a community or a mall or a sporting event or a concert or near an office, and we are present also in your hospital, and it all operates as a network, we are able to respond to more patients. And because we pick up more patients, hospital gets more revenue, but more importantly, we save that life. So that's the business model. And the more hospitals now you add to the mix, the more the network density becomes, the better it is for every patient and every hospital.
This is brilliant, Prabjeet. When I understand the problem that you're solving, and sometimes we go and look at things from a higher level, so that we can understand the problem, that it's not just the ambulance, it is another problem of responding to a call or responding to emergencies, which are usually missed. But if you understand the network effect of having your ambulances parked everywhere, and like you mentioned, you were telling me that you're pretty much available as a service across most large cities, and if you are not present there, you are actually planning to be present there. It's a very capital intensive business. You need to have these many ambulances spread across the city, across multiple cities, and each of these ambulances need to be equipped not only with equipment but with trained manpower. How do you manage to optimally utilize all these resources so that it makes a lot of business sense uh, from being sustainable, financially profitable model?
So Indigo is a very capital intensive model, right? But they are super successful. And you actually answered the question in the question itself. So it is capital intensive, but there is capital available for companies that want to scale up an asset play. So at the broad, at a headline level, we are an asset right company. We have as of September, 56% of our revenues came from ambulances that we own and operate. And 44% of our revenues came from our existing partners on ground that are pre-qualified, standardized, and clinically governed by us. So that means that if I were to just round off the numbers, it's a 50-50 balance between own fleet and partner fleet. This is the first time in the world that it has been done, and virtually no one else in the country has been able to replicate this model, right? Because buying fleet and scaling fleet across the cities, hiring people, training people, calibrating those equipment. Just to take a side step here, when you're moving at 60 kilometers per hour and your equipments are hooked onto a patient, whether it is a ECG or whether it is a syringe pump that is supposed to deliver drops of medicine or a ventilator that's supposed to deliver the life-saving oxygen in a certain volume and pressure, how are those equipments working and calibrated matter a lot, right? Now, imagine if your ICU is shaking all the time. It's like that. So, when I say we are clinically strong, what it means is that we know the specificities of how to get those equipments working in the right order. What are the OEMs? What is the calibration schedule? At my level, at the founder level, I actually have calibration reviews of equipment, right? So, that's the depth that we operate with. Now, coming back, so with respect to the asset heavy business, we are virtually the country's best at it. We are better than any hospital, period. Right? That's number one. On the asset light stage, what we do is when we partner with a hospital or we launch a city, we bring in a small set of ambulances to operate, and then we create clusters of partners around that city. Right? So even though this is publicly available information because I've spoken about it, we have 400 odd ambulances. We are present in 25 cities, but last year I was talking about 400 ambulances when we were present in 15 cities, right? So we front load our assets and then we distribute these in more cities and then we add partner system. So the dispatch tech that we've built is so complex, and I want to just iterate here and reiterate why that complexity exists. Max will not want their ambulance going to Apollo, and Apollo will not want theirs going into Fortis, right? But the patient will want the nearest ambulance to come and save their life, because at that moment, when your family member is bleeding on ground or having a chest pain, you care two hoots about anything but saving their lives, right? But businesses are business and they have a reputation and they have their revenue and financial metrics to maintain, right? We sit in between. So when a patient calls us, we need to quickly understand which number have they called. Have they called their employer, their insurer, or their hospital? Mr. Ravi could have called either of these, right? But our dispatch quickly understands that, because the rule that an employer must have set with us would be don't charge anything, bill it all to us, right? Or the rule that a hospital may have set is if the patient is admitted in some other hospital, please make sure don't bring them blindly. Just ask us a few questions if we can admit them or not. So, for example, no private hospital is going to accept a third-degree burn or a neonatal patient without actual consulting with the patient and patient's family before. You understand what complexity now comes in? Now, I have to do this on the fly. I have to do this across 100,000 plus calls that I get in a month. right? Through 300 plus different sources. And for me to make sure that the ambulance that reaches is the right ambulance, whether it is the hospitals, whether it is a red or a partner, is an exercise of a million plus permutation and combination that we are able to achieve, right? And that technology then plays a role in making sure that our response rate, response success is over 99%. And once you scale it up across 25 cities, you're going to take it to 40 cities. Our asset in place are actually going to remain under 500, while our partner system is going to take up because the dispatch tech takes care of it. So if you're a hospital or a large corporate today, you don't have to do it yourself. You may not even be able to do 10% of what we do. And wherever we operate now with hospitals, their ambulance linked inbounds or walk-ins double in a month. It used to be doubling in 6 months. Now they double in a month.
Awesome. I think this is you just very beautifully brought out the complexity of how the business is done. And uh, are there situations, are there business uh, partnerships that have replicated the earlier model of getting the patient in terms of revenue that you get from a hospital?
If you're asking me the question, if we take a referral from the hospital, the
Mhm.
answer is no. We never have and we never will. That breaks the trust, and it at a very familial level, at a very individual level, I do not want my healthcare decision to be taken by an ambulance operator,
Mm.
right? Nowhere in the world is it okay. But I also have a system in which if you ask me, you tell me your symptoms and you tell me where you are, I have technology that can pick out the right emergency room for you, right? So we internally, about 12 months ago, we used to Google the right hospital, right? And Google is all SEO powered. If a hospital is doing a good job bringing their results to the top, fantastic. But they may not be the right place to go at 2 a.m. at night if I have a stroke because they may not have their CT scan in place or their cath lab may not be working, right? So what we ended up doing is creating the largest census in India for emergency rooms. So if you today ask me Wednesday night at 2 a.m. in South Delhi, which is the right hospital to go to, I actually can tell you which is the right emergency room to go to because I know which doctor and how many equipments and what kind of facilities do they have. So while I have all that information available to recommend an emergency room, I will not give you this information unless you specifically ask me for that. And when I give you this information, I'll give it to you in the most democratic way because I am not monetizing at the back with that hospital to give you that information.
And Pramdeep, today in healthcare in India, what we are seeing is that there's a lot of traction when it comes to healthcare as an industry. There are a lot of companies which are getting into newer businesses, innovating businesses. And if you see a particular model really working well, there are other companies that tread the same path and they even find investors. Ambulance business is also being followed by a couple of other players. As a founder, what is it that you keep working on to ensure that Red Health remains a leader in this space uh, and keep progressing to keep that position intact?
When I was younger as a founder, competition really bothered me. As I have grown, I have realized that this is not a problem of market share, but this is a problem of total addressable market rather. And how can we grow it together? Only 14% of Indians, in case of an emergency, call a qualified operator, rest take their personal transport. So I can keep fighting with my counterparts on how the 14% is split, but I will be missing the forest for the trees, which is how can we bring the rest 86% and tell them to trust us because we will deliver the life-saving interventions on time. That's point number one. Point number two is I do not have the marketing dollars or enough language available in my marketing speech to convince everyone by myself. To give you example, whenever consumer behavior change is required, it's rarely one company. Swiggy and Zomato spent their billions of dollars in convincing us that that 30-minute Domino's delivery is a thing of the past. And actually, we now have a range of restaurants available. Not only did they change yours and my behavior, they also changed restaurants' behavior that they didn't need to have their own scooter and delivery boy, right? Then they changed behavior around packaging, etc. Similarly, Uber, Ola had to do it together. So point number two in my head is, if we really have to go from 14% to 30% of Indians and then 30 to 50% of Indians, this number is 91% in the US, by the way. 91% of Americans will call 911 in case of emergency, but only 14% of Indians will call one of the numbers that they remember or they know. So for me, all the other folks who get funded is great news for the industry, and thereby is great news for me because the total addressable market is increasing. Now, to come to your question in specific, how do I make sure that as a company, we continue to remain the leaders, not only in terms of our customer love, but also investors' capital, and also with respect to attracting and retaining the best talent? For that, we have multiple things that we do. One is that we are at cutting edge of experiments in this industry, not only within India, but we look at things globally, and we want to be at the cutting edge of innovation, whether it is hardware. So when it came to 5G, for example, for the last 5 years, there has been multiple PR articles and launches around ambulances being smart. None of those ambulances worked in real life. They did fantastic. They were in Bangalore. There have been, first time in Bangalore, 8 different hospitals have launched their 5G ambulance. Not a single one worked, right? And today, we've spent 5 years doing hardware research in enabling any equipment to speak to the ER. And we said we're not going to do it as a 5G is nothing but a network protocol, right? But I would not, the emergency head does not want to see waveforms for 2 hours. They want to see alerts and analytics. They want to know when something is going wrong. So what we've done is deep hardware research coupled with our software and our clinical prowess to actually launch what is, we call it SyncX. This technology enables any device to transmit their vital information to the nearest emergency room. And with it comes all the metadata of the patient. So that's something that we solve for. So one is innovation. We are at the cutting edge. Second is we lead with clinical outcomes. I want to proudly be able to announce to media, but most importantly, my parents, that bete se pehle red, that you don't need to call me. I have extreme faith and confidence in my company's ability to pick up your call and respond to you faster than it will be if you call me. And the clinical outcomes will be better. You will clinically be better off calling red than anyone else. So that's number two. We want to be proud about the fact that if you call me, your chances of infections will be lower. The number of days that you spend in the hospital will be lower. And there will be absolute better outcomes in terms of mortality and morbidity if you call red. That's number two. And number three is we lead with deep ethics. You asked me a question about referral. It just is the ethical framework, right? So in an industry that is super dependent on gross incentives, every hospital and every company that we partner with ranks us. Our NPS on hospitals is 90%. Every hospital, 9 out of 10 hospitals will recommend us because they know that we are highly ethical operators.
So, Pradeep, I completely agree with you that business of ambulances is a business of service and business with comes with a lot of responsibility. Have you ever faced medical legal cases? And what is your perspective on medical legal side of it? Because until the patient, like I said, from his home, until he reaches the hospital, you service the patient like a hospital on wheels.
Today, in the month of September, we did over 12,000 patients. We transported them, and this month we are going to do over 13,000. We are growing by about 800 to 1,000 every month. And if you look at the number of patients that lie on a bed that we operate, it's more than some of the largest hospitals in the country do in a month,
Mm.
right?
Right.
So just to, if you're a 400-bed hospital with an average length of stay of 4 days, right? So you're doing about 3,500 inpatient, right? So but look at, we're talking about 12,000, 13,000 patients. So spread across 25 cities and not under four walls in a city.
Mhm.
So the complexity is really, really large. And the scale is also astounding. It's not ever been done. Even 108, the government system, only operates within a state. We
Correct.
are truly the first time in India that any operator in emergency or ambulance has been able to do this across the cities that we do. No hospital has been able to do this across cities that we do,
Mhm.
right? So, first is acknowledgement of the scale,
Mhm.
and second is acknowledgement that with this scale, statistically, some cases will go wrong,
Mhm.
right? And that realization is something that we work with very, very seriously internally.
Mhm.
So, as part of the JCI accreditation, there are international patient safety goals. There are 7 patient safety goals that we internally have. Some are simple, like avoiding infections, right? Which the world has solved for. But then there are more complex, like how do we avoid falls, right? And falls can happen at home, during transit, as soon as the patient is shifted out of the hospital, right? And falls can be really tricky. But there are also medication errors. There are also issues with equipment. So then there is skilling and upskilling. So what can go wrong is as follows, right? You could give a wrong medication. You could, uh, your equipment can malfunction, or your people don't actually know how to handle a situation. So you've really not done good matching between your talent and the situation. So what we've done is we mapped out all these risks. And the idea is to prevent. So that's point number 2. How can we prevent as many risks as possible? So we work with prevention in mind. Third is sentinel events. If anything goes wrong, we need to accept first and foremost that something happened, and then do a proper RCA, a CAPA on what went wrong, and quickly learn from it. Now, good news here is that hospitals face these situations all the time. So we look up to hospitals, we consider them as our elderly brothers, and we look at their systems as a guiding light for us on how do they make sure that consent forms are there, risks are adequately informed, making sure that people are well trained, equipments are bought from the best OEMs and continuously serviced and calibrated, right? So things do go wrong, and statistically they will go more wrong as we increase in size. The absolute number of cases will go up, but my insistence with the team internally is let's prevent as much as possible and avoid sentinel events from happening.
And Pradeep, how do you, because in a hospital, the challenge has always been the reporting of errors. But that is being solved because, most of the errors that need to be reported for future are the ones which have been done by the doctors. And they have been indemnified. But in case of a ambulance, it's the errors could not just be limited to a doctor. It could be because of the driver, the support staff that is there. Is there something that you plan to ensure that, one, they get reported so that you can improve upon it? It's not about taking an action on it, but you need to, further improve for future. Second is, the negligence can come up to your knowledge. And then how do you actually create a safe environment of an ambulance?
Absolutely. So clinical, non-clinical, fatal, non-fatal, 2 by 2, right? So a clinical fatal is a mistake that we made in which the patient was harmed, right? And fatal here doesn't mean fatal in the death way, but fatal as in how we define the error, right? So, what is non-fatal? Not tying the cervical collar in a certain case is a non-fatal, but giving wrong medication is a fatal error, right? Then, uh, non-clinical fatal error is accident, right? A non-clinical, non-fatal error is not wearing a seat belt, right? So what we look at is we have this framework. Now, simple thing, every ambulance of ours has a two-way camera now, right? We institutionalized this after an accident that happened. And all those cameras, when they look at the driver, it has machine camera vision and AI. So we get seatbelt alerts, we get uniform alerts, we get speeding alerts, and we get drowsiness alerts, right? And we have a war room. We have a two-member team sitting 24/7 monitoring those alerts, right? So simple examples. Then when it comes to training, every driver and every paramedic of ours has to go through BLS and ALS training. Drivers need to go through BLS training, right? We believe in training as much as possible. When it came to JCI actually taught us how do we label medications so that when it is dark or we are speeding and we can't read clearly, we still are able to say which medication is which, right? Our equipment calibration and maintenance is all through software, and our oxygen refilling, our oxygen maintenance is all through software, right? So we look at these errors in a grid, and then we make sure that we are learning from every error, and then we create policy and processes around avoiding those errors. Now, I want to just also highlight that the fantastic point that you made around indemnity, right? So we do take patient consents. We are also in our handshake with our hospital partners. We do indemnity and protections, right? And our employees, from director to the pilot, we have health and life insurances, of course, but we also have corporate and general insurances to make sure that in case of any monetary impact, we are also secured. So, as I mentioned, right, Harbinder, the intent, we've been around for 8 years now, and we are scaled up. And one of the core responsibilities that we now have is not only are we red, we are representative of the entire industry. If we fail, maybe another investor will not invest in another company in this space, right? So I have an awesome responsibility of the industry along with the company. And that's why we are very careful and very measured in what we do. And with the scale and the impact that we create, which is increasing every month, uh, we take our jobs really seriously.
This is brilliant, Prabdeep, because like you said, being a leader brings in a lot of responsibility. And I'm so glad that you have that approach that, you have the responsibility to not just grow the industry, but also make it, uh, you know, someone make an industry where standards are taken seriously and can be upped every passing year. Prabdeep, when we began the conversation, one thing that you mentioned was that some of these mom and pop ambulances or fragmented business owners in different cities use their ambulances not just for transporting patients, but also the dead bodies. That's also a very, very fragmented space and, something which is very disorganized. You have mom and pop ambulances, you have somebody who dedicates a free service because something happened in their family. And then you have charitable institutions also running it. So, in that particular space, do you see an opportunity for Red Health to go and disrupt and organize that space itself? Is that a part of your strategy in the future?
You'll be surprised to note that in a consolidated manner, we are the largest transporter of dead bodies in the country already, right? In terms of our market share.
But is that from hospital outward or from home to crematoriums, etc.?
So most of the deaths that are reported in India are reported at a hospital. It could be a public or private because the pronouncing a death is a doctor's mandate. The hospitals that we work with, so first and foremost, bereavement as an industry is not just transportation. Bereavement has repatriation, which is a very large market of bringing uh, people who've expired outside the India back, or people who've expired in a non-home city into their hometowns, right? There is a lot of work that is required around funeral, cremation, prayers, prayer meeting. Now, death in India is a very touchy subject, but when it happens, it is a communal. There's a different ritual for a Hindu, a Sikh, a Muslim, a Christian, right? It is a very societal and a neighborhood. The community participates. And at the same time, it's very individual. Every family has certain rituals that they believe in and they have to do, right? So it is fragmented not because of the operators, it is fragmented because we all want our loved ones to be treated in the most special way, right? Now, that's point number one. But if you look at, we are all aging, and in the next 20 years, there is going to be a generation of India that is not going to be with us. And they all are going to participate in what we call as the bereavement industry. We are going to lose them. They will need to be transported. They will need to be taken care of their remains will need to be taken care of. Now, there are operators, but again, all these operators coincide very strongly with an ambulance operation. And the reason is actually very logical. In Europe and in the US, where embalming is very common, where funeral and wake has almost a week. In India, death is today or tomorrow subject, right? So in a way, it is a mandate of the ambulance operators. And if you look at Mr. Ratan Tata's, uh, you know, last rites that were done from hospital to the home was actually an ambulance operator. Two ambulances were seen rushing by, and I was almost ironically thinking that for a man who, built Tata Motors, he was transported in a force ambulance, and there is unfortunately no better OEM available. There is no Mercedes, no Toyota available, and you could be driving a Maybach, but the ambulance is always going to be a Force or a Tata for you, and that is again something that we want to work with the government to enable better OEMs and electric ambulances to come. But that's a side note. So from a bereavement standpoint, ambulance operators are the right people to cater to bereavement. We, being the largest, have always been looking at opportunities to grow further in this, because when a patient trusts us in their most sensitive, in their most critical journeys, which is into a hospital, they also trust us post, right? Their family trusts us post, and we already do this at scale. Now we are starting to span across the value chain, and we've launched a brand internally. It's called ASTH, ASTH, and it's called ast.red is the website. And we offer everything from documentation to repatriation to funeral and cremation to transport, and helping loved ones post death in any and everything that they may require, from the day itself to the next month. So this is something that customers wanted, that families wanted us to do. So we ventured into it and we've had great success. We don't talk about it often, but it's something that we are growing very rapidly in.
Pradeep, when you're talking about bereavement as a business, uh, you know, uh, it is usually done differently or with a very different mindset compared to any other business, including the ambulances. How do you, within the organization, if you have a if you have a a business called ast.red, how do you run that business with ensuring that that is done with a very different mindset compared to an ambulance business, whereas the resource of ambulance in the first place could be the same? Uh, how do you manage that within the organization? different way of doing the business?
I would argue that the fundamental core values of these two lines of business are same. So at Red, our core values are and have always been for last 8 years: speed, reliability, and empathy. And even in us, speed matters, empathy matters, and reliability matters, right? And it is the same for ambulances as well. So at the very core of it, those core values that my uh, frontline staff or the mid managers or senior leadership has to deploy is speed, reliability, and empathy. Whether it is our air ambulance business, whether it is employer facing or event facing or us, that's what matters to our end customer. That's point number one. Point number two is think of it from how a hospital is able to manage hepatology and neurology and cardiology under the same wing, but also be a great hotel, be a great F&B company, and be a great, laundry setup. I often think that a hospital uh, feedback, good or bad, usually emerges from how the nursing staff was and how the food was and whether the laundry and the cleaning was done properly or not, right? So, so at the core of it, in a clinical setup, non-clinical skill set becomes almost necessary to build as a muscle alongside, right? And think of Indigo. Indigo flies us from point A to point B, but whether it is their app or their check-in or what they do on ground matters as much. So I think of it in a very similar vein. We we transport people in need from point A to point B, and that need is clinical. And most of them are living patients, but some of them have recently passed away. And there is no reason for speed, reliability, or empathy to go away when we are dealing with the patient's last remains or the family member.
And Pradeep, how I'm just very curious because when you were speaking about managing this particular business, I'm very curious to understand that how would you create your presence in this space in terms of advertising and letting the world know that you also have these services? Uh, is it because this is nobody thinks of this unless there's an event that happens? So is it a search based uh, program that you're going to be running, or are there some innovative ways to promote this business, ensuring the empathy at the core of it?
So fundamentally, most of the family members discover us at the hospital that we are already partnered with, right? And some discovery happens online, of course, but word of mouth and referral plays a very important role here. So, when a close member in my family passed away, one of my uncles, actually, other family members came together and did a lot of help,
Mm.
right? And they had some numbers saved and they called, and the elderlies got together and solved this problem, right? Some were able to arrange the samagri, some were able to call the Ragiji and get the Gurdwara call made, etc., etc. So the informal network is actually a word of mouth and a referral. So for us, what is important is through the hospital system where the patient has been for a few days or a few hours, if we are able to get into that phone book or create that trust. And in healthcare, tenure matters. And I always say this. I love healthcare startups, but when it comes to my family's health, I will go to a hospital that has been around for at least a decade or two,
Mhm.
right? And I'm assuming it is the same for you. The brand that comes in your mind for your family's healthcare would have been around for at least a decade.
Absolutely. Absolutely.
It is the same. And one of the things that has started working for us in our inflection is the fact that we've been around for a decade now almost. And patients, patients' families have interfaced with us before, right? And hospitals happily recommend us. But there are more avenues that I can speak to you about.
Mm-hmm.
Government has a lot of employees. Defense has a lot of employees,
Mm-hmm.
right? Embassies care about their citizens living in India.
Mm-hmm.
Employers care about their employees living abroad. Or
Mm-hmm.
if a death occurs in a in during office hours, the office takes that responsibility initially. So once you start double clicking on the opportunity and how and where things happen and who assumes responsibility, you can actually figure out that it's not difficult to reach out. But to create a direct to consumer brand here is going to take tenure, and it's going to require us participating in perhaps the Jain communities networks, perhaps going through Lion and Rotary clubs, or maybe enabling services for Gurdwara or a certain other sect, right? So when we launch a business, and that's what at Red Health we are known for, we digital is the last thing we think of.
Mhm.
First
Mhm.
and foremost, we think of what is the most obvious uh, way. Digital is a very easy and obvious, but it is not it's not usually where most of the problems get solved, right? We are feet on the street. We are building for Bharat and India both, and that's what we've been able to do.
So, Pradeep, since this space is also getting organized, I'm very inquisitive to understand from you that are we heading towards a similar situation that we have seen in the West where people invest during their lifetime for their funeral services so that they can have their wish of how they would want to leave the world?
I haven't uh, seen that shift happen, right? But what I have seen happen more and more is family members wanting more and more to celebrate the life, right? So, and for perhaps sudden or younger bereavement, it's different. But imagine if you have a grandmother who's lived till 92, 95, right? We've seen prayer meetings that have had, uh, you know, uh, m- musicians that have been there at the prayer meeting, right? We've had arrangements that perhaps would put a good wedding to shame, right? So family members are also living abroad, and they are also guilty of family members dying in India. So they also want to make sure that the post bereavement is as comfortable for everyone in the family. So some shifts are happening, but it's, I think, not uncommon with the country becoming affluent. But I don't think with affluence is coming lack of respect or empathy. I think family members still assume a lot of responsibility, both in terms of monetary spends and also in terms of logistical concerns. When you were asking this question, what occurred to me is that why do insurances not cover this, right?
Mhm.
And perhaps that's a question we can leave unanswered, but uh, it is a significant expense. The average ticket size of the entire bereavement process ranges between 50,000 to 5 lakh rupees.
And Pradeep, with a lot of respect and empathy, at the end of the day, how big is this industry expected to be? I mean, the fact that we are looking at entering into this space or have entered into this space, uh, how big is the industry? I won't call it an opportunity.
Yeah. It's fair to call it an opportunity. And, death as a matter has been handled very graciously by life insurance companies for a very long time. And there are also companies that are coming in offering now easy to make will services, right? So as Indians are aging and aging not very healthily, a lot of people are looking at opportunities both in a post-life world and also in better aging and hospice and elderly living. So it's not unfair to look at it as in the same lens. Elderly living is or the sunset living, right? Uh, goes hand in hand with post-life world. So, I don't have the numbers with me because this business opportunity did not start in a top-down manner for us. It started because a consumer said, "Can you please transport my family member who's no more from one place to another?" And this was from Hyderabad to Vizag because the family had come to Hyderabad for treatment and we happened to have the vehicle. And then another family said, can we go from Bangalore to Bangladesh? And then another said, can we take the family member from UK to India, etc. Because they want to see their village for the last time. They may not survive the journey, but we want to make sure that Sade Pitaji are able to see the pind once last time, right? So these opportunities or the discovery of the opportunity or the problem statement came from our patients and their trust on us. So we never actually sat down to do a market sizing, but it's not too difficult an academic exercise to do because we know we are aging and we know the death rate in the country and we understand the country is becoming more and more affluent. So the mass affluent who are going to lose a family member in the next 2 decades, that's the opportunity set. And what my job to do is make sure that I am a trusted brand closest to them and be able to solve problem as quickly as possible, which any which ways in the ambulance and emergency space I'm known for.
And Pradeep, we were talking about the business that you are in as a capital intensive business. And I believe you have raised capital recently. So can you tell us a little bit more about how big the company is? What is the kind of capital that you have raised right now? And what are your plans in the future?
So, our results are going to be published on the we've been audited, and the audited results will be published in a short while. But what I can tell you is that this year, which is the year that's already in progress, FY25, we want to be at nearly 200 crores of revenue. That's our objective. And while also making sure that our profit profiles keep getting better, we are still not, we are still spending money to grow, which is in agreement with our incoming and our previous investors, because the opportunity and the growth potential is massive. So, and we are not done as yet building the scale or the technology or the skilling that is required. Having said that, our margin profile is continuing to improve, and the goal for this year is to have an operating profit that is closer to 30%, right? Now, with respect to the monies that we've raised, we have fantastic investors in Health Quad, in Jungle, and in Kalari Capital, along with a bunch of very prolific investors, individual investors, and angels who've stood by me and the company across ups and downs. I truly believe that it is their confidence and it is their capital that is allowing us to create a very essential vertical within the healthcare space that globally is actually really large, right? But in India, it is nascent. It's nascent not from people are still moving in ambulances, people are still moving to hospitals, but are they moving in the way they should be? No, right? So that's the next step for us in as we scale, continuing to improve the quality and offering the patients a range of products. And I say this with a lot of excitement because when we launched 8 years ago, 9 years to the day when we launched, it was Omnivan, one product, right? Today, our customers are saying, look, I need a Mercedes ambulance, but there's also a customer that's saying, I came to Ames, Delhi, now I want to go back to Saharanpur, and I want a Tempo Trax or Bolero, it doesn't matter, give me the cheapest service possible, right? Even if you put two patients in the same ambulance, it doesn't matter. So we have a country that now is demanding product at all price ranges, at 300 rupees per kilometer to 30 rupees per kilometer. And this is an exciting time for us because we, being the market leaders and category creators, truly are going to now operate across the product mix while also being able to service all kinds of patients, as I mentioned to you, right? So from a neonatal, 1 hour old baby, to a 100-year-old man who's just passed, right? We should be able to service all ages and demographics across the product ranges, across the modes of transport. So whether it is road for 1 kilometer or road for 1,000 kilometers, road across the, we've done, for example, we've transported a patient to Pakistan and into Bangladesh by road. And by via train, so we are the number one in train ambulance today, and we are top three in air ambulance evacuations that we do, rescues, right? So no matter what mode, what kind of patient, across product mix, we should be able to. The aim is to be number one across uh, patient logistics, no matter how the patient wants to move. Uh, that's the aim.
Pradeep, I wanted to ask you a last question, but I have one question before that. What can you explain the train ambulance? I've heard it for the first time.
So a very interesting concept in India is people seeking treatment at the highest center of treatment possible, right? So intuitively, we all know that a lot of people go to Bombay for Tata Memorial, right? Or Breach Candy, or they come to Kokila Ben. They also come to Narayana in Bangalore, or uh, Vellore, CMC Vellore, DMC Ludhiana. So an unknown reality in India is the tertiary and quaternary care hospitals attract patients not only from the neighborhood or the city, but they attract people from anywhere in the country, right? It is well known. It's seen in movies. ये यहाँ नहीं इनको कहीं और ले जाइए, एम्स चले जाओ, पीजीआई चले जाओ, right? We often don't think of the sheer number of kilometers that a patient in India travels for better or the best treatment as perceived, right? There's a large part of India, and I'm now giving you a layered answer. One is clinically, in some of these hospitals, the treatment is indeed better. But there's also a large part of the country today, and this is something when I tell you, Harbinder, you will not be surprised to note, but uh, it could be astonishing for many. We want to live with a feeling that we did everything for our family, right? Almost in a to absolve ourselves from the guilt. If the doctor tells me there's a 1% chance of saving a family member if I can take them to a certain hospital in a certain city, I don't want to live with this feeling later that I didn't do everything, right? So people tend to travel a lot in India for better healthcare in real or in perception. That's number one. Now, there are different modes, as I mentioned. Not everyone can afford an air rescue, and not everyone finds road as convenient. So, one of the innovations that we did was a train ambulance. What is a train ambulance? It is essentially creating an ICU like environment in a train. We take a AC tier 1 cabin, right? We have a doctor, we have a nurse, we have an equipment, all equipment needed, and we have a patient in. And because we are integrated across the country, so if a patient from Raipur wants to travel to Hyderabad or a patient from Bhopal wants to travel to Bombay, we have our ambulances there, we have our people there, we know the stations. So we are able to take a patient from Bhopal to Bombay in a train instead of road, right? And that has been such a roaring success because it is cheaper, it's more convenient for elderlies, and there are less jitters and less chances of something going wrong. Washrooms nearby, foods nearby, accessible rather than being on the road. So that's something that, as a business model innovation, we are proud to be pioneers in and number one in.
That's very interesting. I had never thought of this. I'm so glad that you brought it up and I could ask you this. Pradeep, my last question to you is, in fact, when we were talking about how you are differentiating from everyone else and how you have successfully organized an otherwise fragmented business, the differentiator was truly the technology. You use your dashboards, your apps, etc. And you also spoke about a camera, a two-way camera with AI enablement to able to identify whether the driver is wearing the seat belt or not, whether he's wearing the uniform or not. So clearly, technology and AI in technology is playing a very big role. What is the next big thing that you feel could happen in this space, which could be an outcome of a technology advancement, which could bring in the efficiency in a manner that we'll be able to save more lives than ever before? Is there something that you have in mind?
Absolutely. And it is something that is a reality already in the West. Anyone who's been noticing Apple's keynotes over the last few years will note that Apple has been speaking extensively about human safety and emergency slash SOS. They launched fall detection. They launched crash detection, vehicular crash detection. They launched atrial fibrillation, AFib detection. Now they are also, starting to talk about how calls can be made through satellite when stranded. Globally, what is happening, Harbinder, is that large companies and investors have seen the pattern of disasters, whether it is cyclones or landslides or off-season flooding, etc. And they have understood that climate change is real, and disaster technology or disaster tech is something that over the next 2 decades is something we all will speak of extensively. Now, this could be things like drone monitoring or field command and control setup, right? There's enough and more work that is happening around disaster technologies across the world. A few things that matter that I believe will fundamentally change the fact that Indians uh, unnecessarily lose their lives in emergencies, right? How do we change that? Now, I made a statement that we want to be omnipresent, and that means physically being present. But I believe that the future is going to be present near everything that senses that an emergency has occurred or is about to occur, right? So, in my assessment, most of the devices around us and on us. Think of a watch, a ring, a glucose monitor, a camera, a home safety system, our cars, our fire alarms, our fire systems. All of them today have an ability to send a signal out when they detect an adverse signal. They are able to inform. Now, if I know that the fire alarm on the fourth floor has triggered, or a person who's on 11th floor of a building has had a fall, my life as a response agency becomes simple, right? In the US, this is now seamless. So Prabdeep, whose health profile is so and so, who's had an emergency on the 11th floor of this building, whose preference is to go to this hospital, all of this as a packet of data, Apple is able to now send to 911, right? Now, in India, we don't have 911, and Apple doesn't offer that service. And primarily because we don't have 911, because even though they have the packet of information ready to send, there is no receiving authority or agency. So I think over the next few years, what is going to happen is we are going to go from being a response agency to also opening up to all these devices, giving us that smart packet of information that enables us to respond better and in a more predictive manner.
Uh, you know, Again, it is, I think we're moving towards the importance of data and the intelligence that it can provide to help people. I think this is brilliant. I think, we are going to be moving toward times where this could be a game changer of how people receive emergency response when the need arises.
And Harbinder, it's something that once you peel the onion, the answers look very obvious. So if two cars are getting into an accident with three people inside, cars know that information.
Yeah,
My car knows how many people are sitting because it knows when to give a seatbelt alarm when someone is sitting next to me or not. It knows there are two people or three people, right?
yes,
And then on the other side, if it's an Ola electric or an Ather electric bike, they have all the smart dashboards that tell them whether the vehicle is performing right or wrong, right?
correct,
So if three people get into an accident, now my question to you is how many ambulances should be responding?
correct.
In today's world, one ambulance will show up and decide how many to carry or ferry, right? But all of that information is available today. We
Right.
need someone, and that's going to be us because we are large enough. Because if you are an OEM on the other side, a scooter or a car OEM or a fire alarm company, you want to work with someone who's present across the country because you don't want to stitch together 40, 50 different agencies, right? So now that we've built that scale up and we are expanding from 25 to 40 cities this year, we are going to be able to bring all of these things together, go to an OEM or go to a home security solution company and say, look, we are going to be able to help your customers or your patrons or your stakeholders receive that emergency care. And that's why, so one of the largest airlines in India that we all fly in has is now using us exclusively for their employees that are living in 90 cities,
Mhm.
right? So that's the magic. And I think the funding that we had was to scale our response system because we all knew that once that is scaled, it is virtually irreplaceable.
Mhm.
And now we can actually configure the company towards more distribution, more present on a click rather than on a call.
Absolutely. So Pradeep, this is amazing. I mean, this conversation that I've had with you, not just shared about how a mom and pop business actually turned into an organized business, but also it is building trust, partnering with the industry. So, getting all these small players to come together and be a part of an organized business, not just in terms of providing an ambulance to Red Health, but also getting their teams be trained to provide the service that matches the standards that have been set by Red Health. And secondly, you've turned the trans patient transport business into a truly emergency response business. And the beauty is the technology that you've built in terms of patient management. And when we are looking at technology and the data, I think my assumption, and I'm sure it is true, that before the patient reaches the hospital, the emergency room also has all relevant information available to them so that they don't waste time in providing the treatment to that patient. And then you've understood the opportunity of expansion where the same technology, same resources can be used, and the same way of thinking of the employee that is servicing the ambulance business can also service another industry which is very big, but people choose to not speak of openly. And I observed how you said that we should not be ashamed of calling it an opportunity, because that's the need of the hour, and somebody needs to take that responsibility to serve that particular need as well. Pravdeep, it has been beautiful conversing with you. I'm so glad that we scheduled time to speak about this. I wish you all the best, and I'm sure Red Health has a long way to go, because we have to go far beyond servicing 14% of the population. It has to be far, far more than that. Thank you so much
Thank
for
you
your.
so much. And I am very certain these forums, these candid conversations that you have with founders enables us to think better and deeper, but also carry the message of the industry and help us convince a few more people to call providers such as us to help save their lives. Thank you for that.
Absolutely. Thank you, Pravdeep.
Thank you.